I'm Dr. Mohit Joshi. I'm additional professor of surgery in the here. And this is the picture of our building where the wet lab is housed. It's in SET facility, which stands for Skill E-Learning and Telemedicine Facility. So this facility is dedicated for teaching skills using animal tissues and cadavers, as I told you earlier. And we teach a variety of open surgical, microsurgical, and laparoscopic surgical procedures. So this is the entry to our SET facility, and in next 10 minutes or so I'll tell you that what we have in our wet lab, how exactly it works, and what courses we conduct here for teaching and training. What we have is that we have an ample space here where we can discuss, we can teach, we can train, we can assess on various models on animal tissues and cadavers. We have a cadaver storing facility in this facility as well. We have variety of instruments and other surgical equipment like OT tables, OT lights, electrosurgical equipment, and other advanced equipments. We have many laparoscopic systems with all accessories. We also have some special models. Here you can see that there is a wire cage inside this dummy where the animal tissues, they can be mounted, and this can be used for training basic and advanced laparoscopic procedures. I'll show you some of the images on how exactly it works. In addition to these instruments and equipment, definitely we must have staff and some other material also. So we have a team of dedicated staff members who helps us in organizing various courses. They ensure the availability of facility for these courses. They arrange all the necessary equipment required for each of these courses. They send notifications and reminders to the trainers and trainees as well, and they keep record of whatever is conducted here. We do have 2 experienced persons to handle the animal tissues and cadavers, and then we have a dedicated vendor who supplies fresh animal tissues on demand. Now, why we require training on animal tissue models is that the very feel of these models, it is better than inanimate ones. So it mimics a surgical encounter very closely. Not only this, they are quite cost effective. These tissues, they are easily available, and the whole exercise is reproducible. Now, why we require training on cadavers? Because the anatomy is same as that of humans, so human cadaver. In addition, we use the cadavers which are soft embalmed. Now, this is a special technology, a special technique, where the appearance and consistency of these tissues, they will mimic closely to live tissues. We do have the odor of formalin and conventionally preserved cadavers. However, there is no odor in these soft embalmed cadavers. The tissue planes, they are very well maintained, and they are so pliable that even pneumoperitoneum is possible. Abdomen can be used. So as a whole, because of this, it gives a more realistic experience of surgery. So this is how it looks like on a conventionally embalmed cadaver. But here it looks like exactly like what we see in life. Not only this, we have developed some models for basic and advanced surgical skills. Now, these are some innovations, like we developed models for incision drainage of abscess using animal tissues. Using the same tissue, we have developed model for excision of surface lump. We have again had some innovations in which we can perform dissection in the correct surgical planes in animal tissue models. And then we can teach vascular and bilioenteric anastomosis. I'll show you some of the images. So this is like one of the model which we developed for a combination of incision drainage of abscess, excision of surface lump, and suturing of a laparotomy incision. So just using the same tissue model of pork belly, we can teach and we can train, we can assess these 3 important surgical skills. We have used chicken gizzard and porcine esophagus to teach how to dissect and correct surgical planes. We have used aorta of sheep or goat for teaching and assessing the technique of vascular anastomosis. We use simple material like egg yolk, syringes, gloves, some common materials are available, and then we have made it like this. So this is one of the model for teaching the incision drainage of abscess using the pork belly, and this is egg yolk which is filled in a finger of a glove. This is how it is passed inside the pork belly, and once you can see on the right side of the panel that once like an incision is made, it gives exactly the same feel of incision drainage in real life. These are few tissue models, animal tissue models, which are used to teach how to dissect in the correct surgical planes. On the left side is the chicken gizzard, and the right side is an porcine esophagus, which is filled with saline. It is clamped at 2 ends, and one has to dissect in between the mucosa and the muscularis layer without puncturing the mucosa. Now, once we have developed these models, we convert them into learning modules. So we have had many faculty deliberations and brainstorming on forming a uniform format for a learning modules, and we have developed these SOPs and developed these modules for the set facility. It has some contents like theoretical aspects of the procedure, the steps of the procedural skill, some other relevant material to that particular skill, and there's a component assessment also. So the learners, they have to log in, they go through the content, and then they take the online test. Once they qualify the test, then only they present for skill training in the wet lab. So this is how it looks like. So this is an ESET module for incision drainage of superficial abscess, and you can see here that we have like all the relevant contents related to this particular skill. So we conduct various training programs, and I'll give you a short glimpse of some of the programs which we conduct here in the wet lab. And the beneficiaries here are the postgraduate students of our institute, the MCH residents, the fellows, and not only of our institute, we have included and we have trained some practicing surgeons in various surgical specialties. So this is one of the workshop where we are teaching the basic surgical skills on incision and drainage and how to remove a superficial lump. This was on suturing of the abdominal wall. So from basic we move to advanced one. So we can teach like bilioenteric anastomosis. So this is a porcine liver and the biliary tree where we are teaching how to conduct bilioenteric anastomosis. Now this is again a sheep or a goat's aorta where we can teach vascular anastomosis, and we are conducting sessions on that. So apart from these open suturing techniques, we have microsurgical suturing workshops also. Then this is regarding various energy sources which are used in surgery, and we train routinely our residents on how to use energy sources in surgery on animal tissues. This is regarding how to use surgical staplers for creating or performing a bowel anastomosis. Now we have seen this model previously. It was again a model with a wire cage on which the animal tissues they can be mounted. And this is how it looks like. So basic and advanced laparoscopic procedures, they can be performed on animal tissues with this model. Then we have cadaveric facility, as I told you earlier, and we can see on the left side of the pan, this is a cadaver, and see how pliable this is, so that we have created pneumoperitoneum. And this looks exactly, if you see on the right side panel on the monitor, the tissues, they have exactly the feel, the appearance of tissues, of live tissues. So that was for laparoscopy, and this is for thoracoscopy. So we are conducting training sessions on thoracoscopy as well. So we have a surgical robot where we train on surgical skills on robot. So the possibilities are endless, as you can see, and we are trying to make best use of our wet lab, and we are committed for more skill modules, more innovations, and we are including more trainers. Thank you so much.